One crunchy bite of a Hershey's cookies and cream bar, and I'm taken right back to college move-in day. I was a little overwhelmed by the newness of it all. Boxes were everywhere, I needed a break from unpacking. But just as I was able to take a breath and open my Hershey's cookies and cream bar, my new roommate Rachel walked in. I offered her a piece, but she said no. Then after a beat, she said, "Actually, those are my favorite ones." We laughed. The ice was broken, and we've been friends ever since.
Hershey's. It's your happy place.
You've got better things to do this summer than deal with old appliances. That's why right now at Lowe's, you can still get in on Memorial Day savings and get up to 45% off select major appliances. Plus, get up to an additional 25% off when you bundle select major appliances. It's time to upgrade what's outdated. Our best lineup is here at Lowe's. Valid through 6/3. While supplies last, selection varies by location. See Lowe's.com for more details.
Staying active as you age is such an important part of maintaining your physical, mental, and emotional health. And being outdoors while you move is even better. Some of Jane's favorite hobbies were hiking and taking long walks. So when she began experiencing some bladder leakage and uncomfortable pressure in her pelvic area, it changed her entire lifestyle.
I couldn't be very far from a bathroom. That was one of the problems. But also the pressure was getting heavier and heavier, so it didn't feel good. And if you're hiking and you're really using your core and your pelvic muscles and, all of that, you don't have the strength that you need. I could keep up with my social activities as long as I knew where the bathroom was and as long as I knew how long I was going to be there.
Jane's symptoms kept getting worse, and she began having bowel movement problems. The constant fear and worry forced her social life to get smaller and smaller, which only added to the stress.
I had to buy a purse big enough that could hold my supplies in case I had an accident. I couldn't wear one of those cute little crossbody bags. They didn't have enough room for me. And I thought, this is ridiculous. So I think all of that, mentally and emotionally, the limitation of my activities, this constant fear of, am I going to have an accident? Do I need to get somewhere or not go somewhere because I'm scared I'm going to have an accident? That's just no way to live.
Her breaking point was when the pressure she had been feeling became a visible bulge coming out of her vagina.
The bulge gets so bad, you can actually feel it and you can see it. And it's scary. So when that happened, I went to my primary care doctor and I said, I don't know what's happening, but something is coming out. And she took a look and she said, I don't know which it is, the bladder or the vaginal wall, a vaginal bulge. Let's go to your gynecologist. So she set me up with a great gynecologist in the area where I live. And he took care of me. He told me it was a vaginal bulge and that I was having a prolapse. I had no idea your vagina could collapse. I mean, who tells you that?
Jane was experiencing a pelvic organ prolapse. The condition occurs when the pelvic muscles become too weak to hold up at least one of the organs sitting on top of it, including the vagina, uterus, bladder, and rectum.
Imagine the pelvic floor like a hammock. The pelvic organ prolapse of the bladder, the uterus, the rectum all rest on this hammock of muscles called the pelvic floor. So basically what a prolapse is, the uterus, the bladder, or the rectum pushing on the vaginal wall, and it can create a bulge in the vagina, or it can create a bulge that comes outside of the vagina.
That's Dr. Savitha Krishnan, a urogynecologist at Camino Health. People experience different symptoms depending on which organ is pushing on the vaginal wall. The uterus can cause painful intercourse, and a sagging bladder or rectum can make it difficult to fully empty when going to the bathroom.
So there are so many women, Kristen, that come in and they actually have to put their fingers into the vagina. There's even a medical term for this called splinting, where they have to put their fingers in the vagina and they actually have to push on that back wall of the vagina to get the stool to come out. If the prolapse is out, and if the bladder or the uterus is involved, they actually have to put their fingers in and push the bladder up to start urinating.
It's estimated that nearly half of women will experience pelvic organ prolapse, partly because some of the risk factors are unavoidable, like menopause. Others include chronic constipation, having babies with large birth weights, and vaginal childbirth.
multiple vaginal births, operative deliveries. So like forceps deliveries increase your risk of prolapse almost 8-fold, vacuum-assisted deliveries, and interestingly, hysterectomies.
A fact that Jane was not made aware of when she had her own hysterectomy more than 20 years ago after she experienced a uterine prolapse.
The uterus literally was falling out. It was falling down the vaginal canal. You can feel it. You can touch it. You know it's not supposed to be there. And so my gynecologist, she said, "Yep, you've had a uterine prolapse. We're going to have to give you a hysterectomy."
Since she'd had a complete hysterectomy, Jane didn't realize she could experience a prolapse again, or that she had an even greater chance because of her operation.
Now we're at, 2020, and we're in the store buying diapers because we've had a vaginal prolapse, we've had a bladder that shifted, and now everything's coming down and smushing the rectum, so you're having bowel problems.
Despite how her symptoms were impacting her life, Jane was hesitant to seek treatment. The hysterectomy had taken such an emotional toll that she didn't want to have to go down that path again. But what many women don't know is that there are many treatment options available instead of surgery. For a mild prolapse, physical therapy is a great option.
So in Europe and in Asia, a lot of times after vaginal childbirth, physical therapy is not elective. It's actually pretty routine that people get pelvic floor physical therapy. And in a lot of those countries, the intervention rate for surgery is less. The incidence of prolapse is less. So we know that probably early intervention with pelvic floor physical therapy is helpful. When we see patients with early stages of prolapse, we always offer physical therapy because it's a nice conservative route. And if a patient will continue to do it lifelong, that's an excellent route.
The only issue in America is that people don't stick with the program. A new survey by the Ohio State University Wexner Medical Center reveals that 3 out of 4 patients don't complete their physical therapy homework.
So I always tell people, if you're going to invest into physical therapy, just realize it's something that you need to continue to do the rest of your life so you can make that investment fruitful.
While you can't fully reverse the condition with physical therapy alone, Kristen says an effective program can improve a prolapse by 1 centimeter. Another option for more advanced prolapses is called a pessary. It's often a soft silicone ring that's inserted into the vagina and gives more support to the pelvic organs. While it doesn't fix the prolapse long-term, it does provide symptom relief. Many people like Jane try out the pessary when they are really trying to avoid surgery. Unfortunately for Jane, the pessary wasn't enough to help her reclaim her social life. There are a couple surgical options to choose from, but a lot of the decision depends on how much the prolapse has progressed.
So we've got procedures that are done vaginally where we can keep the uterus and support the top of the vagina and get everything supported well. And those were our traditional surgeries for prolapse, vaginal surgeries, either removal of the uterus in support of the vagina or keeping the uterus and supporting the vagina. And those we know have great success if you're early in your prolapse journey. But if the prolapse is already significantly out of the vagina, we know that using your own ligaments is not so successful. So then this procedure called the sacrocolpopexy has a much better success rate. So the sacrocolpopexy actually has a 94 to 96% success rate lifelong of never having intervention for prolapse.
This procedure used to be done going through an opening in the abdomen, much like a C-section incision. However, that required a few days in the hospital and then 6 weeks of recovery. Now, most surgeons have transitioned to a laparoscopic procedure, which uses a much smaller incision.
But this is a daunting laparoscopic procedure because you're actually putting a lightweight piece of mesh on the front wall of the vagina, back wall of the vagina, and you're sewing that mesh down on the front wall and back wall because you're giving, instead of using your own ligaments, you're using that graft as your support. And that's why the success rate is much, much higher with this procedure than using your own ligaments. And that's why when you have an advanced prolapse and those ligaments are all really stretched out, this works better for patients because you're not using stretched out ligaments, you're using that strength of that synthetic mesh. But because there's so much suturing that's involved, laparoscopic procedures can take somewhere between 4 and 5 hours.
But in recent years, some surgeons have been using robots to assist the procedure, which has drastically cut the operation time.
So the robotic procedure has allowed us to take this 4 or 5, sometimes, when I go into academic institutes, sometimes 6-hour procedures down to about 2 hours, 2 hours and 10 minutes.
The surgeon uses small robotic arms to sew in the mesh, which allows them more control and precision.
You're really in charge of everything. So you're moving the robotic arms, but instead of having straight sticks and trying to tie knots with straight sticks, you've got an articulated wrist. So that articulated wrist really allows you to tie knots very efficiently to actually get the procedure done much, much quicker. When you operate robotically, you're also not like when you operate straight sticks, sometimes because you're a human and you're moving your instruments, the port's moving with you too, causing a little bit of trauma to the tissue there. So when you're operating robotically, the instruments, the port's stable. So the robot is basically moving, the port is not moving as much in the skin as it does with straight stick.
Meaning that the patients have less pain at the incision site. Not only is this operation much faster, but most patients are able to go home that same day.
And then we call everyone the next day. And most patients are going, tell Dr. Krishnan, I'm out on my walk. I just took a Motrin. So they're walking. So I usually tell people, go out by 2 weeks. I'd like to see you up to 2 to 3 miles, because the more walking you do, the better you're going to heal, the less clots you'll have in your legs, the better you're going to open up your lung fields, right? You're just going to heal better and feel better if you actually get out there and move.
So instead of the 6-week recovery, Krishnan says most of her patients are back to work after 2 weeks. A couple days after Jane had her surgery, she was already walking around the block. And not long after that, Jane was finally able to reclaim her life.
I had to build up my confidence, and I took some longer walks than I normally take to see how do you feel, Jane? Can you hold it in, before you get to the bathroom? And I could. That was incredible to me. That was something so simple that had been so hard was now routine. I was back to normal.
Krishnan hopes women become more aware of the treatments for pelvic organ prolapse because there are life-changing options, and no one should let feelings of shame or embarrassment keep them from living a full life.
We see these patients that are just living with miserable qualities of life for such a long period of time. So I'm just thinking somewhere along the way, we've got to increase the awareness that they get to the right place earlier, because we have such great options. And it's funny, because it's perceived as elective, because it's perceived as maybe normal with aging, I think we have to kind of get rid of that and say it's common with aging, but you don't have to live with this quality of life because we've got options for you.
You can find more information about Dr. Savitha Krishnan and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farrah.
How much growth could your 401k be missing right now? Did you set it and forget it? That could be expensive. Studies show professionally managed 401ks could add hundreds of thousands by retirement. That's where Bison comes in. Our advisors actively manage your existing 401k, no transfers or rollovers, helping power your retirement. Try the no-obligation calculator at PowerMy401k.com. Bison Wealth is a fiduciary SEC-registered investment advisor. See PowerMy401k.com for additional information.
Amazon Health AI presents Painful Thoughts.
I can't stop scratching my downtown. Yeah, but I'm not itching to go downtown and tell a receptionist I'm here to talk about my downtown. Some things you'd rather type than say out loud.
There's no question too embarrassing for Amazon Health AI. Chat your symptoms and get virtual care 24/7. Healthcare just got less painful.
On any journey using Uber, it helps to know you're getting into the right car. PIN verification adds an extra step to make sure your ride is your ride. Before the trip begins, your app gives you a unique PIN. Just tell it to your driver, and they'll enter it in their app before the ride can start.
Hey, what's your PIN?
2538.
That way, you know you're in the right car taking the right trip, and your driver knows you're the right passenger. Make sure your ride is your ride with PIN verification from Uber. One more way Uber is putting safety at every turn. Learn more on the Uber app.